Hey guys, sorry about the weird angle. I'm just driving to work, so I'm just using my phone. I can't seem to find my camera battery charger, so not that I can use my camera at work if I vlog, but because it's like, you know. But yeah, so I apologise if the quality and whatnot at times isn't the best because I don't have the newest iPhone. So yes, apologies for that. But welcome to my YouTube channel. My name is Kylie. I'm an Australian. If you didn't notice from my accent, I live in Australia. If you're a returning subscriber, then thank you for watching again. And if you're new to my channel, I would love for you to subscribe if you want to. I make, sometimes I make like lifestyle sort of videos, but I also recently went back to work because I have an 8-month-old child. She was our big surprise baby. And I also have 2 kids in school with my husband, and yeah, I've been on maternity leave for the last 8 months or so. I also work part-time, and I've been, since coming back from work, I've been making vlogs related to my job. If you are new and you don't know, I make vlogs around my job, and I am a health administration officer in a hospital, and I've worked in health. I live in Queensland, Australia, so I'm in the public health system. I work in the public health system, and I work for Queensland Health. So it's a really good job. You don't need to get any certificates. You don't need to study to get into this career. You don't need to do anything. Like, you can work in hospitality, you can work in a call center, you can work in retail. Like, I've had lots of people ask me how to get into this job, and it's just how you present your resume, how you make up your resume and your cover letter, and you just got to keep applying and keep applying. But as I always said, I'm really want to help as much as I can, because I think it's a really great job, especially in Australia. Like, I'm not afraid to say how much I get paid an hour, but I'm an AO3, which is administration, and level 3, which is just like basically just the level that you go into if you have anything to do with patients on the phone or face-to-face or anything like that. So I get I think, what was it, almost just got to the car park, so I'm just waiting for the boom gate to open. So I'm not afraid to say it because you can look it up, you know, because it states how much you get or whatever, like it states your wage and everything. So yes, I'm permanent, and it's the same for if you're on contract or whatever, but I get 37, almost, is it? I think, because we just recently had a pay rise, so I get 37, almost, I'm pretty sure it's almost $37 an hour. Yeah, so obviously I'd get a lot more if I worked full-time, but I only work part-time, so obviously I only work about 40 hours a fortnight, so we get paid per hour, so it's, like I said, it's about $37 an hour. Yeah, so I just got to work, so yeah, so it's about $37 an hour, and every couple years, I think you get, like, the government increases your pay, and like we do get more than the nursing staff at there, unless they get up to a high level as well, because it's kind of the way it is, because a hospital and health is still a business. Even in Australia, it's still a business at the end of the day. So yeah, so basically, you know, if you you get more, we get more money than the nurses, because unfortunately nurses save lives, they help save lives, which is so important, but we make money for the hospital. It's crazy how that dynamic works, honestly. I think nurses should be getting more than they do, but yeah, we help make money for the hospital, so we get paid pretty well. But yeah, so sorry, this went on a rant. But yeah, I am a reliever, so I used to work after hours, and then they changed me because digital hospital came into play, and yeah, so we do a lot of things. We're not paper free, but we're just paperless, and we do a lot of things digitally now, and mostly use computer systems and everything for patients. So anyway, I better hurry up because I'm late for work. So I'm a reliever, and I get sent to numerous different places, and today I'm working in maternity. So I hope you like this vlog. I'm sorry if you watched my last vlog. It was really difficult to get any footage because I was working in the oncology ward, but today hopefully I'll be able to get some content. Anyway, thanks for watching, and I'll check in with you guys later. And if you like these sort of vlogs, I'd love for you to subscribe. Okay, thanks, bye.
I was knocked down, heard the countdown through the haze, in the face of defeat, yeah. I was ruled out with no bailout, on my own, all alone, left to bleed out. But I rose up from the ground, just like I was spellbound. All the odds were against me, so I picked up the pace, and now I'm in the race. Give me some space. I'm a movement and I ain't losing. Gonna go, 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 like a boom.
Hey guys, so oh my gosh, it's been a hectic day. It has been so hectic, honestly. Like, as I said this morning, I worked in the maternity ward, and I haven't pretty much worked in that ward probably for about a year, because I worked in the ward like well before I went on maternity leave. So yeah, it was just a lot. And you know, it's really hard sometimes being a reliever, because you just constantly go to different places around the hospital, and in some aspects it's really good because you get like a taste of different like environments or different like areas, I guess. And you know, you just get to move around and whatnot, and there's a lot of positives to that too, but the negative is you kind of feel like sometimes you get thrown in the deep end, and like the general work side of things is pretty much the same. Like the general, like, you know, admission, I can't even speak apparently. The general workload, or the general work, like admitting a patient, discharging a patient, transferring a patient, it was just the same. But it was just like some days you feel like you're on the ball. Like yesterday, I was in the oncology ward, and it's like a ward, but it's also like a clinic. But obviously, I also had another AO there too, so it's like we were sharing the workload. Whereas today, being in the maternity ward, I was only AO because I was there covering the full-time AO's roster day off, because they have like, you basically, if you're full-time, you do like half an hour each day extra, and then that goes toward like a day off that you get. Like, it's called an ADO, which is additional day off, and you get one of those each month. I don't do that because I'm not full-time, so I don't accrue RDOs. Anyway, yeah, so it was hectic. Like, the phone just didn't stop ringing. It was constant. And then obviously within the visiting hours time frame, like, they have the buzzer, like they have the they have the monitor outside the big doors, and that's always been there, not just before COVID, but that's always been there. Obviously it's for like safety reasons, especially if there's like probably like domestic violence situations or something with a woman giving birth and having a baby. And then, like, you know, maybe she doesn't want the partner or whatever, you know, just like a lot of just situations like that. Not that it happens all the time, but you know what I mean. So just as safety to protect the patients, excuse me, they've always had the monitor outside the doors. And it was just like constant people visiting, and then I'd have to like, obviously, like, I'd touch the thing and I'd be like, hi, who are you here to see? And then, or whatever, and then I'd press the unlock button and it would unlock the door or something like that. Or if I knew I could see them and they were just a patient and I knew them, or I knew that they were a patient's partner, then I would just let them in. It's open. I'd just say it's open. But yeah, it was just really busy. Like, I just felt very overwhelmed. Like, I didn't take a break. I didn't take a break until about 12 o'clock. So I didn't take like a morning tea break or anything. I was just like, just wanted to like catch up with work, and I just didn't want to be behind, and I just wanted to have my shit together. And it's just hectic. It was a hectic day. And it was being a bit critical of myself, because I was like, I just didn't want to leave work behind. And I hate having like leaving work for other AOs, or for like, I didn't want to leave work for the AO tomorrow to come in and do, and just, you know, but it was a lot. There was a lot of patients going home, so there was a lot of patient discharges. And then there was like a couple of ladies that came in. They had to like be admitted, and it was just a couple of couple of ladies that came in for inductions. And yeah, so, and then it was like, we had a couple of patients who had the scheduled cesareans today as well. So it was just a lot. It was a lot going on. But yeah, the freaking phone didn't stop ringing all goddamn day. But yeah, like I said, yesterday I felt like I was on the ball. I like had it, like I just knew what I was doing. I was just like, you know, but today I just got so overwhelmed, and it's just so much work, and it was just like constant. It wasn't like you felt like you didn't really get a break to be able to catch up. It was just like constant, and it was just like so many discharges to do today. And then yeah, it was just a lot. It was full on. But I am so glad that the day is over and I don't have to work tomorrow, which is good. So that's good. I get to spend it with my 8-month-old baby, who I really missed today. And it was a bit surreal being back in the ward. One of the midwives, because I had my baby at the same hospital that I work in, because it was just like easy and convenient, and that was my local hospital. That was my hospital to me. Like, so I went there, and the midwife that came out on a home visit to come and see me and Layla after I had her and after I was discharged, and to check on my progress and everything. Yeah, she was working today. She was working the morning shift, and I recognized her, and I was able to like say, "Oh, hey, I knew you looked familiar, but you're such and such. You came out and visited me at home for a home visit after I had my baby in March." Yeah, so obviously she wouldn't remember the baby, because they deliver a lot of babies every shift and stuff, but whatever, like, you know. Yeah, so anyway, it was really good. Yeah, it was really nice seeing her. I was hoping that I was going to see the midwife that was with me in surgery after I had Layla, but she wasn't obviously on day shift, so I didn't get to see her, but maybe next time. But yeah, anyway, so it's just crazy. It was just a crazy day. I'm just like so glad it's over. But the AO that works in maternity during the day, she's really nice, and she is really lovely, and she's like, she knows the workload is crazy, and she has an after hours as well, and the after hours lady, she does like three days a week. So that's the only, basically, besides from emergency, obviously, the maternity ward is the only ward that still does after hours, because the workload, they just have like a high turnover of patients, obviously, and stuff. So yeah, and it's a lot of different like areas and stuff. So, but yeah, it was nice being back in there. It was just very overwhelming because it was just a really busy day. So I just felt like kind of like a bit shit when I didn't know something, or, you know, yeah, but it is what it is. I mean, like I said, sometimes when you're a reliever, you kind of feel like you're thrown in the deep end at times, but then it's just like, that can also be a positive, because you really like learn a lot too. So yeah, I don't know, but I do apologize if I didn't really get much footage. It was just so busy. It was just really difficult. Like, I could have, because of the like location of the desk, like, and whatever, but it was just really difficult to get a lot of footage. So hopefully I am able to put a little bit of footage in this vlog from today, but if not, I do apologize. Like I said this morning, I do try. When I can, I will, but at times it's just real life, and it's difficult, and you just, you know, you're obviously focused on, and you're obviously focused on trying to do a good job too, so, and that comes first. So yeah, so anyway, but yeah, it's Thursday, but yay, it's Thursday. Thursday is over and done with, and my weekend has basically started now, because I don't have to work tomorrow, because it's not my normal work day. So yeah, so I get Friday, Saturday, Sunday off, and then I'm back to work Monday, and then I get Tuesday, Wednesday off, and then I work Thursday. So next week is good, because it's only a 2-day week. It was so, actually, to tell you the truth, it was that busy today. Like, I have a big water bottle that I brought, and it was so busy today. I didn't even really have time to drink my water. Like, it was just crazy. Cray. But yeah, I'm going to wrap up this vlog now, and I hope you guys are doing well as you can. I hope you're having a good day or a good night. Whenever time you're watching this, it is really hot in Australia at the moment, and I wear like not cardigan, like, I don't know, depends what you call them in what country you're watching from, but yeah, sort of like cardigans, but it's like a very thin material. But the thing with the hospital is that when it's like starts getting really hot, which is the 3rd of December today, so it's obviously the 1st of December, it's officially summer for us. I was about to say winter. No, that's America. Yeah, so it's officially summer, and yeah, my kids also go on finish school at the end of next week. They're pretty much finished school for the year, which is awesome, because in Australia the kids finish their schooling year in December, and then they go on this Christmas summer school holidays, and then they start again in January. And then throughout the year, they have like 2 weeks, to break up each term. So yes, they get 2 weeks holiday to break up each term. So they go on holidays next week, and they'll be on Christmas school holidays, and it's just crazy because my son he's going to be in year 6 next year, and that's the last year of primary school. So he'll be 11 in January, and then year 7, when they turn 12 and they go into year 7, that's officially high school in Australia. So yeah, it's interesting, but so that's, and then my daughter is going to be in year 4 next year, so it's crazy. But yeah, it's like I was saying before, when it gets really hot, the hospital, like generally in certain parts of the hospital, it's quite cool, and they have to keep the temperature at a certain level with like the air conditioning at a certain level, because obviously it's just like hygienic, and just helps keep things more hygienic, with like medications and just sterile things, keeping things sterile and stuff. That's why in like, theatre and stuff like that, it's a lot cooler than other parts of the hospital. That makes sense. But anyway, I swear in summer, they must turn the aircon down a lot, even more. So yeah, certain spots, depending on where you are, it can get quite cool. So I always just have like a cardigan or like a long sleeve shirt, or like a long sleeve shirt, or whatever I'm wearing. Because it's sometimes depending on where you are sitting in for your admin desk, you can sometimes have like the air conditioner vents over your head or just near you, so it can get very cold. So yes, the hospital can get very cold. But yeah, it was alright today. It was pretty normal. But yeah, anyway, I'm gonna stop talking because I've been talking way too long, as I do. But anyway, I hope you're all doing well, and thank you for watching. If you've made it this far, feel free to go and check out my playlist. I have a playlist of admin videos if you're interested in checking them out. There's one in there that just lets you know, sort of gives you ways on how to get into administration if you're interested in that. And there's also I kind of was able to do a little bit more behind the scenes in palliative care, the palliative care ward. So I show you a bit of that. So yeah, there's just a whole heap of different vlogs for you to go and watch if you want to. But yeah, if you like this kind of content, then I would love for you to subscribe. But yeah, that would just make my day. Anyway, thanks for listening to me ramble on if you've made it this far. But yeah, thanks for watching, guys, and I'll see you in my next vlog, hopefully next week. Bye, guys.